All right. So I got it. Yep. So Jamie, raise your hand. And then we have Frederica Fafi, who is our secretary.
Hi.
Hi. LaMonica Jones, our treasurer. And Sarah Whalen, who I don't think is here, is our ex officio advisor. And one of the things this board is very committed to is increasing the level of involvement by our parents at these meetings, so much so that we have an outreach committee. So several people who are thinking about how to increase attendance and working on that. We have Sarah Byrne, who is the chair of that committee. We have Jen Gagler, who is on that committee, Andrea Keene, and Kay Taylor. An important part of this process is the work that we do in concert with our PG CPS advisors. And so Trinell Bowman, who is our associate superintendent for the Department of Education, Karen Andrews, the director, Department of Special Education, Beth Hare, instructional specialist, family engagement, Marcy Torshan, program coordinator, family engagement, and Yvette Young, social worker, family support center. And I should have said, if I incorrectly say your name, please blame it on my head and not my heart. I'll do my best. But if I don't, you can chime in, correct me if you want, but please don't blame me for it. Our agenda today, it always is one of our most important meetings because our kids are going back to school and, we've had the summer and things that we need to know to support. So this meeting being very important, we want to hear and get our updates from Trinell. We also will hear from the transportation department, and we have Kiba Baldwin, who is the director of transportation. We have Amish Allen, the transportation coordinator for special education. We have Herbert Bridges, the transportation coordinator for special education. Then we'll hear from health and safety and hear from Dr. Tracy Jones, and then our family support center. And we'll hear from Beth Hare. We'll hear from Marcy Torshan and Yvette Young. Our presenters have about 15 minutes to present, and part of that is usually to open it up for any Q&A. So I'm going to turn it over to you, Trinell, to get us started with the updates.
Wonderful. Thank you all so much. And happy 23-24 school year. Welcome to all of our new families and returning families to Prince George's County Public Schools. I'm just going to share a few updates with you. Again, we always would like to thank our Prince George's County Board of Education members for all they do to support students with disabilities, as well as our new superintendent, Millard House II. Our Prince George's County Public Schools demographics, I always provide this slide to you at the beginning of the school year. We have, again, over 131,000 students, 22,000 employees, 201 schools and centers, as well as our demographics. As you can see, we're now a district that's about 39% Hispanic Latino. We have about 52% of our students are Black or African American. Our special ed population represents about 10.4% of our overall student population. And our English language learners, which you'll hear us transition this school year to multilingual learners, represents about 23.8% of our district. So I think it's important to always share our demographics at the beginning of the school year and what our student population looks like. I just want to remind everyone that we do have a Prince George's County Public Schools strategic plan. When you get the slide deck, you can find the link that leads you directly to our strategic plan. It's a 5-year plan that started in 2021. It goes through 2026, and it really communicates what our mission, vision, and core values are. As parents and stakeholders, you also have the opportunity to drive the results and outcomes of our strategic plan through climate surveys and other focus groups and other areas in which our strategic planning and resource management offices reached out. It talks about our strategic imperatives, how we're making progress, and then our common framework in which we as staff members work towards those common goals of collaboration, really looking at our equitable approaches and transformation. So I wanted to make sure that if we have any new family members that have joined Prince George's County, that you are aware of what drives our work in our district. The other thing I wanted to make sure you are aware of is that we have an in-person instruction plan or continuity of services. And this has been updated even as we've come out of COVID, although we know that those COVID numbers in some places are increasing. That this just gives you kind of what our plans are if we have to look at and follow, of course, the Center for Disease Control. Is information about that. It's also information, and I know that Dr. Jones will be joining us a little bit later to give an update around our COVID response, but there is an in-person instructional plan that I wanted to make sure all families were aware of. And again, if you click on this link, it does give you some additional information about that guide. And I do want to emphasize that members of our SECAC board in past years, as well as other special ed families, were instrumental in developing our response as it relates to our safety in person and return to school plan. The other thing I wanted to share with you is our Superintendent Millhouse II. He has developed what he's calling a 90-day entry plan, planting the seeds, listen, learn, and lead. And it's really grounded on his 90-day entry plan into Prince George's County Public Schools. Since he's been with us, he has visited schools, he's met administrators, he has been to our Summer Leadership Institute with principals as well as assistant principals. He has attended a variety of meetings, both in the community, as different community groups, churches, etc., as well as members of the community. I've given you a link to the 90-day entry plan. You will see information that directly ties to our update or our 2.0 version of our Department of Special Ed strategic plan, as well as schools that have been expanded, etc. On the next slide, I wanted to share, if you have not heard the superintendent, on the next slide, we have the dates for his listening session. So one of the things that he talked about in his 90-day entry plan was that he would be hosting superintendent town halls or listening sessions, giving him an opportunity to hear directly from community stakeholders. So the town hall dates are listed here. The first one kicks off tomorrow evening at High Point High School, which is on the northern end of the county, from 6 to 8. Then on October 10th, he'll be at Oxon Hill High School from 6 to 8 p.m., which is all the way on the southern end of the county. For our mid-county area, he'll be at Charles Flowers High School on October 18th. Then he's also hosting a virtual town hall meeting on October 23rd from 6 to 7:30 p.m. So I wanted to make sure that our CCAT members had those dates, and you probably also saw them in our PGCPX Express newsletter, and they will also be followed on our social media outlets. I wanted to make sure everyone was aware that we do have a special ed parents page that's available for our parents, and we'll continue to update this page, but it gives you information for families who are suspected of their child having a disability, what supports and services are available, etc. But we did put that right on our landing page to have parents have an opportunity to be able to review information that's critical for them. The other thing I wanted to share is, as part of our FY24 budget process, that was approved by our board and the county council in June of 2023. We did add a new position. Karen Andrews is now our director of special education. And so we're happy to have her join the team in a new role and new capacity. And so I did provide you with a new org chart where you could see those offices in green that will report directly to Ms. Andrews, and then the other offices that will continue to report to me. We also have added, or will be adding, it's been posted, but going through a new position for assistant supervisor for the alternate framework. And these are students, they'll be supporting students both in general ed and through programs of students who take our alternate framework assessments or who are on the alternate framework instructional pathway. So that was also a new position that we did add through the budget process. I wanted everyone to be aware of that. Our special ed staffing plan was approved August 24th, 2023 by our Board of Education. This is a plan that must be submitted each year to the Maryland State Department of Education that really illustrates how we provide staffing. We probably provide over 60 different configurations of staffing guidelines, both for our infants and toddlers, birth to 3 program, all the way up to students who are in age 21. Not only does the staffing plan provide you with information related to how we actually staff our schools as it relates to special education, it also talks about professional learning and development, what that plan looks like as a department. What do we do if we have special ed vacancies, et cetera? So I've provided you the link. It is on our landing page on the special ed website, but I wanted to make sure you had that direct link. We do have a special ed staffing committee that does look at trends and data and where we may need to make adjustments. On the next slide, it just gives you our Department of Special Ed strategic focuses for 23-24. We did an implementation of a pilot of our tiered systems of support in terms of how we would support priority schools. And now we're going to work through that implementation of that tiered systems of support. I'll be sharing more information about that. We also are going to train our teachers on the use of evidence-based strategies at the elementary level. We work to actually incorporate in our district mathematics framework some strategies that our elementary teachers could really focus on when working with students with disability. We're going to pilot the use of our monitoring system for select schools to really evaluate the quality of service delivery models, and then continue to rethink how we can best support students with autism, social emotional behavior needs, and specific learning disabilities. Coming soon, you'll see this in Superintendent's House the Second's 90-day plan that we will be updating our special ed strategic plan 2.0 for school years 2024 through 2027. So that will be coming soon. And we also will have an opportunity for SECAC members to directly be part of a focus group to look at where we are and recommendations for where we should head based on our data. And then the last slide I wanted to share with you is we provide this each year, a special education resolution team contact list of who you can call or contact related to special education matters. And I will make sure I update that so that everyone can have access. Thanks, Marcy, for pulling that up. We provide you with the list of special ed instructional specialists that are assigned to every school across the district. If there are general questions about placement, programs, or IEPs, we also provide you a list of your compliance team that are assigned to each school with the hyperlink. And then we have other subjects that may be important to parents of special ed students in terms of health services, school boundaries, and transportation. So I'll make sure I change that permission to make sure that everyone, whether you're a PGCPS staff or not, have access to the updated contact list. And that concludes the portion of my presentation for this evening. And then I'll turn it over for family support, the team, for just some quick updates for you.
Trinell, I think transportation is going next.
Mm-hmm. Yes. Yeah, I just
Thank you.
before we turn it over to transportation, just want to see Any questions of Trinell before we, and Baldwin?
Good evening, everyone. My name is Alemnish Allen, and I am one of the special education transportation coordinators that works with the Department of Transportation. As stated, we also have with us Director Kiba Baldwin. And thank you. And then Mr. Herbert Bridges, who's also a special education transportation coordinator.
Good evening, everyone. Glad to see you.
Good evening.
Good evening.
First of all, let's welcome everyone for school year 23-24. Welcome back. It's a pleasure to see everybody. We'll provide our PG County School District mission, which is to provide a transformative educational experience anchored by excellence and equality, developing 21st century competencies and enabling each student's unique brilliance to flourish in order to build empowered communities and a more inclusive, just world. Now, our transportation mission is to deliver efficient transportation and fleet services that enable all students to arrive to their destination safely and on time every day. Our commitment is we will collaborate with parents, students, and school staff to enhance the learning environment and establish a culture where all employees have an influential role in the educational, social, civic development of students.
Thank you, Mr. Bridges. So very quickly, because I know we're a little behind on the schedule, we're going to be going over the who's who in transportation, along with addressing communications, operations, and student bus information. We're going to also briefly discuss transportation as a related service, information relating to closures, delay, and inclement weather, and where to find that information pertaining to annual bus staff training, along with information on how concerns are best resolved. We do have there the transportation resolution system link, along with the transportation phone bank number, which is 301-952-6570. If you'd like to take that down, if you do not have it already. The TRS is located at trs.pgcps.org. And we'll have some more information regarding that in a little bit as well.
Now, what you see now is basically all our transportation supervisors. Each supervisor is in charge of 2 individual bus slots. You'll notice next to all the bus slots, there is a letter that corresponds to that particular lot. So if your child rides a bus with a letter in front of it, if you have a concern or situation you want to bring to our attention, when you give us that bus number, it will contain a letter first, and that'll let us know which person we need to contact in order to be able to help resolve your situation. As you can see, we have 2, 4, 6, 8, like 12 bus slots. We also have 2 operations supervisors. That's Mr. Hill and Mr. Sproul. And Ms. Allen and myself are the special ed transportation coordinators. And of course, all of us fall under Mr. Baldwin, who is the director of transportation.
Yes, and just to clarify also, just like the supervisors have their assignments, Ms. Allen works with students, last names A through L, and Mr. Bridges works with students, last names M through Z. Thank you. Mr. Baldwin will go over our transportation challenges.
Good evening, everyone.
Good
Thank you
evening.
for the opportunity to address this committee. It's a very vital committee. And right now, I must say you have 2 people who advocate strongly for your students every day, day in and day out. So to have them as part of this team, it's a privilege to me to be able to work with them day in and day out, because I know the effort they put in working to make sure that your students are properly taken care of for their bus ride. I'm going to make this really quick because they have a lot of stuff to go over. As you know, we're in the bus driver shortage, and there's no getting around that. I'm a new director. I came aboard in late July, and I see it. And we are working very diligently to help reduce that. But there are some things in the meantime that we can do to help ease your concerns and to help us out as well. So we're always hiring. We have bi-weekly job fairs for driver recruitment. For driver retention, we are doing ongoing training with our staff. The biggest part is about our safety courses, about first aid and CPR, some nonviolence crisis prevention training. The third one that we're working on is our communication. That's a very important piece. And obviously you can never have enough communication. And so we are working within our systems to advance. There's some features within the communication system that we can do that we are operating right now. And this is dealing with the Stop Finder app. And I'll give you an example of one that we're working on is extending the viewing time of your route. So if you're able to see it right now, there was only a 10-minute and a 15-minute viewing. We've actually extended that time to almost 90 minutes, up to 90 minutes. So you can see well before and well after your planned pickup time. So we're advancing some of that, and we will be sharing more information to all of our families on doing that. We're working on giving you a robocall, a text, or an email to let you know the status of the bus. Very vital. And that's utilizing the system that's already in place. Many of you already use it with School Messenger, with your schools, getting attendance calls or any information dealing with that. And so we want to bring that into effect within transportation. So be on the lookout for that in the next coming days as we work to implement that for all of our families. The fourth one is our routing. We're consistently working on our routing. I tend to tell my folks we have a very fluid plan. Nothing stays static for long because of the constant changes and new enrollees that we have in our system. So what we try to do is make sure that we route our students in the best possible way, and we give you ample opportunity to be aware of any of the adjustments that need to be made. But just understand that routing never stops for us, and it is always reviewed to see if there's something that we can do better for your student and for yourself. And then the last thing that we have are our transportation initiatives. And the biggest part that from there is the superintendent has, as part of his 90-day transition plan, has ordered a transportation audit. So we will have a company come in and basically do a review of all of our transportation procedures and processes and help deliver some recommendations on what we can do to improve our transportation system. So I'm looking forward to having those conversations with that team and as well as hearing from more of our parents about what we can do. But I just want you to let you know that your voices are not going unheard. We average about 1,500 calls a day into our call bank. We average about 300 transportation resolution systems inquiries every day. And so my team works very hard from 6 o'clock in the morning till about 6 in the evening to try to respond as best they can to all of the inquiries that we have. And so we do ask for your patience. We do ask for your understanding, but please don't give up on us. If you have those questions, concerns, please let us know, because there are some instances that we can work with you very instantly to have a fast resolution. And there's some that we're going to need to take more time. And we want to tell you that you may not always like that response, but we do want you to know what we're doing and how we're doing it, and as best we can. So that's going to do it for me. Thank you again. I know there's a Q&A session that the team has for you at the end, and I look forward to hearing from you, and good luck to the rest of this school year. Thank you. Ms. Allen, back to you.
Thank you, Director Baldwin. So the first point of contact for any transportation concerns are definitely taking place at our schools. Our transportation point of contacts are assigned at each school, and that's a staff member at each school that helps to coordinate the morning arrival and the afternoon dismissal. They have access to look up student bus information, and they maintain the student list to ensure that students are boarding the correct bus to and from, or rather from school, and getting off at the correct bus when they come to school. They monitor the student transportation issues. If there are any referrals or any student disciplinary reports that are provided from the bus staff, that is given to either the transportation point of contact or a school administrator, and then they will follow up with the necessary individuals, whether it be the special education transportation coordinators or the bus lot supervisors, to follow up to make resolve the concern or see what kinds of things need to be implemented in order to ensure that all students are safe on the bus. If there are any issues with any equipment or late arrivals or any bus concerns, the transportation point of contact at the school will be the first go-to. Mr. Bridges, you're on mute.
I'm sorry. Communications. Prince George County, we have approximately 1,200 buses that work on transporting up to 85,000 students a day. The Communications Center serves as the first line of transportation communication for parents, schools, and for bus staff driving students. We now understand at the beginning of the year, we experience increased hold times because a lot of our situations usually pop up at the beginning of the year. It does slow down as we go further into the year, but right now we're extremely busy, but we're still trying to be attentive to everyone's needs. Staff members are working to answer phones from 6 a.m. to 6 p.m. on the daily basis. The Communication Center is here to assist with ensuring students that are transported safely to and from school. And we are currently hiring and looking for staff for the phone bank to assist with the volume of inquiries. I'll repeat the number again as far as for the help center or the help desk. It's 301-952-6570. And it still is open from 6 a.m. to 6 p.m. Monday through Friday.
The
Go ahead. I'm sorry. The Special Education Transportation Coordinator, that is the job that me and Ms. Allen take. We work collaboratively with the Department of Special Education to ensure the provision of transportation services for students with disabilities within comprehensive and special school settings. We are like a liaison between the parent and transportation, and also a lot of times between transportation and special education. We represent the Department of Transportation at IEP meetings. So if you're in an IEP meeting with your student and he is a special education student and has an IEP that involves transportation, someone from transportation should be invited to that meeting at all times. We handle the coordination of student safety vests and specialized equipment. So if you have a student that is in a vest or wheelchair or something along those lines, we would need to be involved with that as well. We work with the school and transportation operator staff to assist with the placement of students on appropriate routes. So if we have a situation where a kid is misrouted or things along those lines, that will come to us first, and we will get in contact with routing and try to make sure that every student is routed properly. We participate in the coordination of planning and implementation of professional development activities or special needs bus personnel and supervisory staff. So those trainings that the driver and the attendants go through, we help to coordinate that. There are also things if the child has special health concerns or things along those lines, we help to coordinate that with as well.
A transportation representative is a part of the IEP team when transportation is determined as a related service. And the transportation department can provide valuable information that's critical in the development, review, and revision of the student's IEP. As transportation staff are responsible for the children's safety while they are in the vehicle, they are also experts as what's needed to keep the child safe on the bus. Accordingly, their voices should be heard and be a part of any problem solving and decision making that takes place at the IEP meetings. Now, while our bus staff may not be able to attend the IEP meetings because they may be out busy driving on the road, myself as the transportation coordinator, Mr. Bridges, or the transportation supervisors represent our transportation staff in the IEP meetings. Again, we should be looking at when we talk about determining transportation as a related service, discussions may include their cognitive, medical or physical or mobility issues for students, where the pickup and drop-off location is. It's also important to consider the length of the ride time to and from school, if there's any additional personnel needed for transport, where the student is currently being educated for their least restrictive environment, any special equipment needs and building accessibility needs, along with any travel training or other supports that may be needed for students, as we want to ensure that students are successful in entering post-secondary goals. Now, a lot of people ask, do most students with disabilities and IEPs require special transportation? And the answer is no. There's a very small population and percentage of our students that have IEPs that utilize specialized transportation. Oftentimes, most of our students utilize the same transportation as their classmates who do not have require transportation. Sometimes there may be some adjustments that may be needed to be considered for the general regular bus. Now, there are some times where students are receiving education in a least restrictive environment that is outside of their school boundary. Oftentimes, that is the reason why the students are provided with specialized transportation because it's not within their regular geographical boundary. There are some students sometimes that have, for extenuating circumstances, some special transfer requests. That does not always automatically students provide them with transportation services. But it's also important to note that when students have siblings that attend the same school and they may be routed on 2 different buses, the ride along on the bus is granted on a case-by-case basis as long as there's space available on the bus. So those are all just important things to consider when we talk about students that require special transportation.
Pick up and drop off determination in the term curb to curb. Neither IDEA or Section 504 of the Rehabilitation Act specifically addresses whether transportation should be from a designated spot or bus stop or from the curbside in front of a child's home. That decision is left to the IEP team and based upon individual needs of the child. It is not door to door, it is curb to curb. And it is the safest, most accessible and maneuverable curb where the bus can travel around safely. So, for instance, if you live in a cul-de-sac, that may be an issue where we may not be able to bring the bus to the front door. You may have to go down to the end of the street or the curb of the street where the bus will stop to pick your child up. There are other situations where it's a dead-end street, or it may be too narrow of a street to maneuver a bus down. A lot of times we have streets that are so narrow and people are parking on both sides, the bus can't safely maneuver. We require that the buses do not back up because it's hard to back up a bus without making contact sometimes with another car. So it is the most safest, most maneuverable spot closest to the house. Now, this does not mean we do not stop at front doors. We do on occasion when we can do it safely and the bus can maneuver. Now, there may be addresses that are not fully accessible or safe for the bus travel. Stop locations concerns will be addressed by the transportation supervisor and getting feedback from the driver trainer for each bus lot. So if it's a situation where we're not sure, the driver trainer and the supervisor of that lot will actually drive out to the stop to see if it's a place where we can maneuver and determine whether we can stop at the front door or whether we'll stop at the corner.
Thank you, Mr. Bridges. I also just want to add that students who are receiving transportation as a related service, as a best practice, the staff is trained that there should always be a parent or guardian to meet students from the bus in the morning as well as in the afternoon. It's important that there's a parent or guardian that is there, and that's just the policy. If there is a student who the parent feels should be able to get off the bus by themselves, that may just involve a conversation with the school team just to determine what is best and on a case-by-case basis.
And Ms. Allen, if I could jump in for just a second. Also keep in mind that the parent is expected to come out to the bus to meet the driver and the attendant. The attendant will not walk the child to the front door. The expectation is that the parent comes out to the bus to meet the child.
Thank you. We're going to talk about specialized equipment really quickly because we've gotten a few questions about this throughout the years. So all specialized equipment, regardless if it's a vest or a walker, a wheelchair, all equipment should be utilized according to the manufacturer's instructions. Please take care of any specialized equipment that is loaned to you from the school system. A lot of equipment is very expensive to replace, so it's important to know that intentional damage may result in fines or fees to replace that equipment. So it's very important to keep it stored away for safekeeping, and we do instruct the schools to make sure that they're doing the same thing. It's also important to have any routine and preventative maintenance of specialized equipment. Trays on wheelchairs are not to be transported during transport unless it's used as a postural device. And you can see there's any equipment concerns should really be reported to the school or the appropriate health or related service provider.
Transportation and inclement weather. Decisions are made as far as clothing the schools from between 5 a.m. and 6 a.m., which must be authorized by the CEO or the designee and announced by 6:30 a.m. 2-hour delays, no work study, for 2-hour delays, there's no work study, there's no ECC, pre-K, field trips, or special education programs. Also, non-public schools may follow their local jurisdiction protocols. The decision to extend reduced scheduled days on a 2-hour delay is at the discretion of the non-public school. Transportation and scheduled closures. Non-public transportation service when PGCPS is closed. PGCPS provides transportation services based on the current non-public school calendar. When PGCPS is on spring break, we continue to transport for non-public schools that remain open. When non-public schools are on spring break, PGCPS does not provide transportation, obviously.
Okay, moving on quickly because I know we're probably over our time. So the school transportation contacts, Family Support Center, and the non-public office, they all have access to view the bus information along with our communications line center. Notifications come from the bus driver, the school info finder, as well as the parent stop finder app. It's important to note that all parents must have an email address on file in the family portal in order for the stop finder app to go out for the invitation for the parent. Okay. As Mr. Baldwin explained earlier, there are other features in the app that you'll find. There's an email address there if you want to screenshot that. If you have any questions about Stop Finder, that's who can assist. And effective dates for transportation starts on Mondays and Thursdays of each week. And all address changes cannot be accepted from transportation. Like if you call in, you have to contact the school registrar, the non-public registrar, in order to make any changes to the student's address. The bus driver, communications bank cannot accept changes over the phone or email or the TRS.
Ms. Allen?
Yes.
Can I chime in real quick? I put a reference page link in the chat. It takes you to the School Max Family Portal, and this is where you update all your contact information for transportation, an email, a phone number, address, all of that. If you have to register in the School Max Family Portal, so if you can do all of that, then we make sure that we have your contact information, and we'll be able to send you more up-to-date transportation information. Thank you.
Thank you. So annually, you can see the list there of extensive training that our bus drivers and attendants participate each year, whether it be in person, hands-on, and virtual training. Mr. Baldwin mentioned some of this information earlier, along with health training that's provided. If there are students who have specific individualized plans that the bus staff should be aware of, the school may provide that training to the bus staff, and we can coordinate that between transportation and the school.
How bullying on my child's bus will be addressed. It's essential to immediately address any known bullying that occurs on a school bus in order to restore a safe transportation environment. All bullying and harassment incidents are to be documented by school bus staff and reported to school administrators for a thorough investigation. All students, PGCPS and non-PGCPS students, are expected to follow the expectations of the PGCPS Rights and Responsibility Handbook, and you can see that on page 24 and 25 of that book. Resolving transportation complaints. How are complaints about the bus driver or aide directed? The complaint should start at the school level with the school-based transportation point of contact, administrator or IEP case manager or non-public specialist. You can contact the transportation department at 301-952-6570 to report the concern. Our phone bank hours are open from 6 a.m. to 6 p.m., Monday through Friday. And what is the protocol for resolution? The concern is forwarded to the appropriate transportation supervisor who conducts a thorough investigation. If the concern is regarding accommodations provided through transportation, the transportation coordinator for special education will be included. Upon completion of the investigation, the transportation supervisor will take the appropriate action. Keep in mind that the TRS is probably the first place and the best place to start any concerns that you have regarding transportation. And you can see the link down below, trs.pgcps.org, and that will lead you to the transportation resolution system.
I can hear the Oscar music playing, so I'm just going to go ahead and let you know that we have a fax play page for frequently asked questions on the transportation website, but that's visible for everyone. At the end of our presentation on the next slide, we also do have an evaluation for tonight's session, along with the QR code that'll lead you to that evaluation. On that evaluation, if there are any specific questions that you have that could not be answered this evening, please feel free to enter your questions in the space allotted at the end of the evaluation. Then we will be sure to get back to you. We do appreciate everyone's time and your attention, and we just appreciate all of the collaboration to make sure that all of our students are transported to and from school safely. Thank you so much.
Good afternoon, everyone. Thank you for having me. I only have a couple of slides to talk about, so we'll start that. So good afternoon. I am Tracy Jones. I'm the supervisor for the Office of School Health. My office is responsible for pretty much all things medical, the nurses coming up with medical policies and procedures, private duty nurses, home and hospital approvals, some health education, and those types of things. So today's goals, today we're going to talk a little bit about the Office of School Health, some updates, give you some COVID updates, and then we're going to talk a little bit about Hazel Telehealth, one of our newest initiatives. So what's new for the Office of School Health this year? Our nurses are, they are an 8.5-hour employee. They work 8 hours a day and they get paid for 8 hours a day. One of the best things about this year so far is that every school except for 4 have a full-time registered nurse there. And we're working diligently to get the last 4 schools covered. The nurses are responsible for providing 8 healthy educational activities a year. In addition, our nurses are working primarily now on immunizations. Immunizations is a state requirement. And if students do not have their immunizations 20 days after the first day of school, they can be excluded, not withdrawn, but excluded. And so if you get an exclusion letter, please make sure that you speak to the school nurse to ensure that you can provide the necessary immunizations. It's primarily our kindergartners. They need their second measles, mumps, and rubella, and then our 7th graders, which require a Tdap and a meningococcal. But there are other grades as well that do need vaccines, especially if they are on a catch-up schedule. If once we get the information, we do have an electronic medical record, and we can put them in as soon as you give them to us. Our office is also responsible for private duty nurses, and for private duty nurses, if we have to do a nursing assessment initially, and then we'll do an updated one on an annual basis to determine if the child needs a private duty nurse. And then once the assessment is done, we come back to the table. We notify the parents that they, in fact, their child is deemed eligible for a private duty nurse. We then do a private duty nurse agreement in which the parents, the principal designee, the teachers, the agencies are at the table, and we pretty much go through what everybody's role is so that everybody understands and is on the same page about their agreement. We do have 7 new vendors that have recently been approved that we're going to tap into to try to get us for additional private duty nurses. One of our latest initiatives is Hazel Telehealth. It is a telehealth program that provides both physical and mental health. There is a consent form that has to be signed. Once you sign the consent form once, it is good for the entire time at Prince George's County Public Schools. We are actually increasing the number of schools that will have Hazel Telehealth. Right now it's at 63, but all of our elementaries, middles, and academies, charter schools will be receiving the equipment. And what happens is if the child comes in, there's a consent form on file, we can dial directly to a provider. The child will see the provider right then and there. Depending on what the diagnosis or the outcome is, will determine what the next steps are. It could be as simple as they need a Tylenol. And so by seeing the provider can order a Tylenol or any other over-the-counter medications, and the child can receive that. This will allow the child to stay in school. It will prevent you from having to leave work to come pick up the child. If they deem that the child actually does need to go home, but they may need, say, an antibiotic, they can put a prescription into your neighborhood pharmacy where they can, where you can go and you can pick it up. You still have to pay for the prescription, but at least when you pick up your child, the visit has already occurred, and you won't have to take additional time off to take your child to the provider. Make an appointment, take them to the provider, then get the medication, and then start the medication. So usually kids can return within 24 hours after beginning the antibiotics. And so that is, one of our newest initiatives. We encourage everybody to sign, for all the parents to sign a consent form. So some COVID updates. First of all, COVID isn't going anywhere. It is here. It's not going anywhere. We're going to have, our cases are increasing daily. Masks at this time are optional. The system has not changed that requirement. If people want to wear masks, they can. If they don't want to wear masks, they don't have to. But that is subject to change if the health department, CDC, the state all feel like, that needs to change, then it could possibly change. Nurses do typically wear their mask while at work, only because when kids are sick, they are the ones that they will go to. We are not doing testing this year. I did put on this slide where you could get home kits. The government, as of Monday, opened up where each household could receive 4 COVID home test kits. And so I did put that on here so that in case you would like to order that. But like I said, we are not ordering or providing any type of test. If a child is positive, then the child needs to stay home for 5 days from the date of the test. And then they can return to school on day 6 through 10, but they must wear a mask day 6 through 10. If they are unable to wear a mask, then we will reach out. I suggest you reach out to the school so that the school can provide some alternative arrangements. If a child is positive, they do not have to have a negative test to return. I know that is out there that you have to have a negative test to return. You do not. There is a COVID reporting survey because it is still a reportable disease to the health department. And so if your child is positive, please notify your school and let the school nurse know so that we can complete and track the cases of COVID. If a child, all the other students within that child's class will receive a notification saying that there was somebody who tested positive. We do not give the name or anything like that. We just let them know that someone tested positive. That letter goes home just so parents can, watch for symptoms. It provides you anticipatory guidance of next steps. If you want to get your child tested after you've been notified that somebody in the class tested positive, we do recommend that you wait 5 days before you get him or her tested to ensure that you actually get a true a test result. We are encouraging everyone to keep their child home when their child is ill. We want to keep every child as healthy as possible while they're in the school. So if your child has a temperature of greater of 100.4 or greater, take it with a thermometer, not the old-fashioned way of, you know, touching the forehead, touching under the chin, touching the cheeks and say, oh, they feel warm, so therefore they have a fever. So we actually want you to take the temperature with a thermometer. If they are nauseated, they have upset stomachs, they have diarrhea, if they're complaining of, you know, severe headaches or sore throat, we do ask that, you know, you keep them home. If they have any discharge from the eyes, yellow, crusting on the eye lashes, we do ask that you keep your child home. If they have some kind of a rash, or they have a constant cough, or they're having problems breathing, we ask that you keep the child at home. Because again, just like we're asking you to keep your sick child at home, we're asking all parents to keep their children who are sick at home. We want to, like I said, we want to keep our kids healthy. We want to keep our teachers healthy so that they can be ready to educate our children. That's it for me. Any questions?
Thank you so much, Dr. Jones. I'm going to continue to move us forward, and hopefully we'll have a few minutes for questions at the end. We're going to hear from our Family Support Center, from Beth, Marcy, and Yvette.
All right, give me 1 second to share the screen.
While Marcy is sharing the screen, my name is Yvette Young, and I'm one of the members of the Family Support Center, and we're really excited to have everyone with us tonight. We know that you've been receiving a lot of information, so we're gonna make this as brief as possible. And once again, we always like to thank the Board of Education and Mr. Miller House II for the support that they provide for special education students and the work that we do. This is our virtual office, and you'll see our virtual office in our correspondences. I will quickly just reintroduce the members of our office. Dr. Beth Hare is an instructional specialist, and she is also a board-certified behavior analyst and a former teacher who brings a wealth of information and expertise. In addition, driving the slides tonight is Miss Marcy Torshin, who is also a former teacher and is a program coordinator and brings a wealth of information about accommodations and accessibilities. Myself, I'm Yvette Young, a social worker, but we're excited that we have new staff in our office. We have a new parent liaison, Miss Angela Salmaron Hernandez, and she is a bilingual parent liaison with experience within Prince George's County Public Schools. And we're excited for her that she has joined us now. And wait, there's more. We actually this year have a student intern, a graduate social work student intern from the University of Maryland, Baltimore. When you see our virtual offices, you'll see also the link to our mission, and our mission statement, and also which includes SECAC information about SECAC, our resource guide, and our calendar of events. And there is a sheet there that we had been using if you want to request a consultation. I'll cover more about consultations in a second. So if you would like to contact our new staff member, this is the contact information for Ms. Samaran. And we are excited because now our Spanish-speaking families can have someone to speak to them in their native language. And this is Ms. Samaran's email address and the phone number to the office. And if you'd like to speak to our social work intern from University of Maryland, Baltimore, her name is, did I tell you her name? Wow. Her name is Najuma Lewison, and that is, she can also be reached in our office, and she'll be with us this year through school year 23-24. And she'll be helping us with projects. So who are we? The Special Education Family Support Center is here to assist families of students who have an IEP or special education needs, or even to answer questions or concerns if families think that their student might have a disability. And our goal is to support and empower families by sharing information with them so that they can learn more about their child's disabilities, increase their awareness about community services they might be able to access, resolve concerns. If there's concerns about the IEP, we collaborate with community agencies that we can share information about, and we partner sometimes with community agencies so that our families get the firsthand information on resources that are available. And we also share information with families and support and empowerment through the workshops that we schedule. And again, you will be able to have access to our calendar of events. And I'm pretty sure somebody's going to cover more about our events later on. We have parent support groups where we not only share information about supporting students with disabilities, but also parents can exchange their experiences with each other and support each other. We offer consultations, so you can call us if you would like us to review your child's IEP with you. We have the time to take to comb through all of those pages of that document and help explain those services and all the items that are in the document, help you list questions that you might have and prepare for the next upcoming IEP meeting if you like. We can also attend the IEP meetings with you to serve as an additional support. We do community outreach conferences. We have a newsletter that is soon to be approved. The fall newsletter is coming out shortly, and all kinds of resource information as well. And now I'll turn it over to my next colleague.
Hello, good evening. So Yvette gave you an overview of our office, and I also wanted to mention that our office is a federally mandated office, and all school districts has an office that provides the supports that we provide to families. So one of our responsibilities is to actually collect data on the services and supports that we provide to families, and we report that information to MSD twice a year. So looking at some of our data from last school year, we had contact with about 298 families. We attended 53 IEP meetings. We held 3 conferences, one in the fall, and then we had one in the spring, and we had our first in-person event, which was our first annual Autism Summit last year in April. We had 203 activities and or workshops that we provided to families, support groups as well. And we served about 106 schools. The families came from over 106 schools throughout the district. As I said earlier, we're a federally mandated office, and one of the requirements that our school district and other districts have are to participate, have our families participate in a parent survey. So annually, The state of Maryland sends out surveys to families of students who receive special education. And I just wanted to quickly share some of the results from the last school year, from the 2022-2023 school year. They mailed out about 12,728 surveys, and we had a response rate of about 4%. We're always looking for ways to increase that response rate. So we'll be looking to members of SECAC to try to help us to increase that outreach and drive up that number. The survey is available both by paper and or line, and in total, about 483 families completed the survey. Here's a really quick overview. There are about 24 indicators that families respond to, and if you see the data here, our district only met 2 of those indicators. The target was 73% or higher. So just at a glance, we have some work to do. And I think our biggest work is with increasing the number of people who actually respond. And so again, we'll be looking to SECAC to support us with those outreach efforts, because we really want to know how families feel about the supports and services that we're providing at the schoolhouse and within the district. So a couple upcoming events. I mentioned earlier, last year we had 3 conferences. So our first conference is going to be starting in October. We will be having a school psychologist present on learning disabilities, and then we will follow up that session with a specific presentation on dyslexia, and that will be presented by an outside clinical psychologist. Our behavior support group is actually scheduled to begin this Thursday, and we will have 10 sessions throughout the school year, and we welcome parents to attend. The support group is based on principles of behavior analysis. It doesn't have to be a maladaptive or inappropriate behavior. We also talk about supporting children with acquiring and increasing skills. The next series that we'll be having is an IEP backpack series. And one of our charges as being a family support center is to make sure that parents really understand about their child's IEP, understand the content of that IEP, and know what to do when they have questions or concerns about the information that's contained within that document. So over the course of this school year, we'll take 3 sessions to really take apart that IEP so that parents have a greater understanding of what is contained in their child's document.
All right, so we just threw a lot of information at you, but we wanted to make it a little easier for you to access that information. As Beth said at the very beginning of or as Yvette said at the very beginning of the presentation, our Bitmoji office will always have our calendar, our resources, our consultation information. But I wanted to give you a quick tutorial too, and each of these circles is a link of how exactly to get to our information, both on our PGCPS website and through social media. So first here, when you go to the main PGCPS website, there's a banner that runs across the very top. The second link in is academics. Once you get to academics, if you scroll down, you'll see special education. Once you click on special education, you'll be able to access our Family Support Center website. And once you access our Family Support Center website, you'll see that we have some important links. There's all of our contact information here. We have our calendar of events. We have the services that our office provides. Our Parent Center resources. Our office is also the parent surrogate office for students who are in foster care or have court-appointed guardians. And then we have some additional information and resources. Let's see if I can get back to where I was. And next we'll talk about some social media, and this is where we really post and advertise all of our events. So when I clicked on the Family Support Center, you were able to see at the top that there were 2 links. One of those is the Family Support Center YouTube. So if you actually go to the Family Support Center YouTube, it has a new title this year. It is the PGCPS Special Education Family Support. And then you will be able to click subscribe on the side of it. And this link is active. And here's the link as well here. And that will allow you to get notifications in your email of when we upload the video. For example, we're recording our SECAC meeting tonight. We will have that within the next 2 weeks posted to our YouTube channel. So if you ever miss a SECAC meeting or a presentation, they are posted there. The other thing we have is our Family Support Center Twitter. If you are on Twitter, or I guess it's called X now, you can click follow, and it will also give you notifications of when we advertise for events, when we post information and resources. But those are 2 of the social media ways that you can keep up with our office. Beth mentioned a little bit about this earlier. We have started planning for our spring information as well. We are in our 13th annual Parent Empowerment Conference, and it will be from March 16th, actually through April 20th, 2024. And it will culminate with our second annual Autism Summit. And I believe the Autism Summit's actually April 20th. So we'll change that before we send it out. And Beth also mentioned our Maryland Special Education Parent Survey. Typically, it runs from about February to May, with you receiving things in the mail about mid-February, but those dates are still to be determined for 2024. And lastly, here's how to contact us. Beth, Angela, Yvette, myself, and Najuma now for this school year. We do have a listserv. We try not to spam your emails a bunch. We'll typically send things out bi-weekly or once a month, depending on the urgency of the resources that are sent to us or that we need to share. And when you get the presentation, or if you'd like to scan it now, this links to a Google form to sign up for our listserv registration.